F41.9, the ICD-10 code for anxiety disorder unspecified, is billable, but using it without documented clinical rationale invites denials, audit flags, and lost authorization. It is one of the most used and most misused codes in behavioral health billing. This guide covers the F41.X anxiety code family, when F41.9 is appropriate, how it compares to F41.1 for GAD, and what your documentation needs to survive a payer audit. Code definitions, the differential decision tree, documentation requirements, and common denial triggers. F41.9 is the ICD-10 CM code for anxiety disorder unspecified. It applies when anxiety is present but the evaluation is incomplete, the patient is still being assessed, or symptoms do not fit a specific category. F41.9 is fully billable and valid for use as a principal diagnosis in 2025 and 2026. Anxiety disorders affect an estimated 40 million adults annually. They appear on a significant share of all behavioral health claims. Choose the wrong F41 code and you risk claim denials, audit exposure, and underpayment, even when the clinical work was excellent. Unspecified codes without documented rationale are a common audit flag, and PHP or IOP authorization requires stronger medical necessity justification when F41.9 is primary. The F41 block covers 5 codes. Selecting the right one depends on what the evaluation shows and what documentation supports. Let us walk through when each code applies. F41.0 is panic disorder. Use F41.0 for recurrent, unexpected panic attacks with persistent concern about future attacks. Cued, situational attacks belong in the F40.X phobia block, not F41.0. F41.1 is generalized anxiety disorder. F41.1 requires excessive worry for at least 6 months, plus at least 3 of 6 symptoms, and all 6 DSM-5 criteria must be documented. Missing the 6-month threshold or the 3-symptom count is the most common reason F41.1 claims are denied or downgraded to F41.9 on audit. F41.3 covers mixed anxiety depressive presentations. Use F41.3 when anxiety and depressive symptoms are both subthreshold, neither meets full criteria. If severity warrants PHP or IOP, a more specific primary diagnosis typically supports authorization better. F41.8 is for other specified anxiety disorders. The clinician specifies a named presentation, for example, limited symptom panic attacks, that does not meet criteria for a single disorder. Unlike F41.9, F41.8 requires the named reason to appear in the clinical record. F41.9, anxiety disorder, unspecified. Use F41.9 when anxiety is present, but the evaluation is incomplete, or the patient's symptoms do not fit a more specific code. F41.9, without documented reevaluation after 6 months, is a primary audit flag. Reassess and recode at each level of care review. The choice between F41.9 and F41.1 directly affects authorization and reimbursement. F41.1 carries higher authorization likelihood and is payer preferred when all 6 DSM-5 criteria are documented. F41.9 is acceptable short-term, but payers expect a clear path to diagnostic specificity. For F41.9 to withstand audit, the clinical record meets 5 things. The patient's own description of anxiety. Verbatim language carries more weight than a paraphrase. Duration, frequency, intensity, and at least one functional domain affected: work, relationships, or sleep. Brief notation of which specific anxiety disorders were assessed and why criteria were not met. A direct statement, for example, diagnostic formulation pending full psychological evaluation. When the diagnosis will be revisited, typically within 30 to 90 days. The most common F41.X denials are preventable. Document your rationale and include a plan to refine the code. Strengthen functional impairment documentation. Show why the level of care is warranted. Add severity specifiers, or consider F41.1 if full GAD criteria are met. Duplicate coding is a direct denial trigger. They are mutually exclusive. A purpose-built behavioral health EHR changes this workflow at the point of care. Structured templates prompt clinicians for each criterion, so missing documentation does not cause a denied F41.1 claim. The coded F41.X diagnosis links directly to treatment plan goals and progress note templates, keeping documentation consistent. Integrated revenue cycle management is designed to flag diagnosis to level of care mismatches before claims go out. Accurate F41.X coding protects your practice on every front: reimbursement, authorization, and audit readiness. See how Behave Health's EHR and revenue cycle tools are designed to support defensible anxiety coding. Book a 20-minute demo at behavehealth.com.